So, will all this be enough to prevent a pandemic, or are we overreacting? Joining us now is an expert on pandemics, Lawrence Gostin, a professor of global health law at Georgetown University in the US and an advisor to the World Health Organization. Well, Professor, thank you very much for joining us.
Pleasure.
Can we start by asking you, will the vaccines being trialled be enough to prevent mass deaths from swine flu around the world?
Well, if it turns out to be safe and effective, those countries that actually have the vaccine will be protected. The problem is that there won't be enough vaccine to go around, and the global poor, as usual, probably will be hit the most.
Are we overreacting?
Well, we're overreacting unless we make sure that this is a safe and effective vaccine. A number of years ago, Gerald Ford actually lost the American presidency because he tried to push a vaccine for flu too quickly, and it caused many diseases and lots of adverse effects. And so we have to make sure it's safe and effective. Right now the disease is not that serious, and so we don't want to have a bad vaccine that really causes more harm than good.
But Professor, there are plenty of skeptics out there, and this will be an absolute bonanza for the pharmaceutical companies.
It will be. As long as we behave responsibly, I'm not concerned. I mean, we've been asking the pharmaceutical companies to develop vaccines, but we want to make sure that there are proper human studies, that they're safe and effective, and we don't want to rush it to the market before we know that.
Is there a risk that swine flu will become another Spanish flu with millions of deaths?
There's only a very, very small risk. I mean, at present, it's a benign disease. It causes far, far fewer deaths than regular seasonal influenza. It could mutate, and in fact, when the Spanish flu first came out, in its first wave, it was mild, and then it mutated. So we need to be cautious.
All right. You're an expert on pandemics. Has swine flu progressed as you thought it would so far, or has it been an alarming rise?
Well, there are two things that are notable. One is that it's so far very mild. Most people just get ill for a week and recover on their own. But the other thing is WHO just recently said that this is spread twice as fast as other novel forms of influenza. So we've had, in a matter of weeks, it's spreading right across the globe in an unprecedented way. So this is a very highly transmittable infection.
Well, that being the case, the chief scientist at the Australian company, CSL, performing the human trials in Adelaide, said the government could fast-track the process if it felt the benefits outweighed the risks, since the trial was basically about finding the appropriate dosage. Is speed more important than dosage in this instance?
Well, it's a question of speed, dosage, safety, and effectiveness. In the United States, the CDC, just a few hours ago, said that we can't push this forward, we can't fast-track it until we've done the human studies. They haven't been done yet. Australia was the first. The U.S. is about to undertake them. So let's just let's be sensible about this. If we just start to throw money at it and get it right in the market, what could happen is a lot worse than the disease at present.
Professor Lawrence Gostin, thank you very much for your time.
It's a pleasure.